The recording start. Perfect. All right. Well, thank you for joining us for the next hour to learn about the health and financial benefits of increasing Iowa's tobacco taxes and how to support this work through the Iowa Health Initiative. My name is Jackie Kale. I'm the Government Relations Director for the American Cancer Society Cancer Action Network. Today's webinar is hosted by the Tobacco Prevention Alliance, which includes ACS CAN, the American Heart Association, the American Lung Association, the Campaign for Tobacco-Free Kids, Clean Air for Everyone, and Americans for Non-Smokers' Rights. The Iowa Health Initiative, established in 2007 during the last tobacco tax increase, is dedicated to reducing the death and disease caused by tobacco use in our state. Represented by organizations, businesses, and the healthcare community, the Iowa Health Initiative is united around advancing proven, evidence-based policies that will save lives, improve health, and strengthen Iowa's future. So why are we here today? As I'm sure you're well aware, Iowa is facing a serious cancer problem and a budget shortfall. This presents us with an opportunity to advocate for a tax increase that will reduce the burden of cancer and other chronic diseases while providing the state with a new source of revenue. According to research from the Iowa Cancer Registry, we have the second highest rate of cancer in the nation, only behind Kentucky. Tobacco use in Iowa is still the #1 cause of preventable death. Our smoking rates are higher than the national average among adults and youth. Lung cancer remains among the top 3 cancers in our state, with tobacco use causing over 80% of those cases. In addition, today you will learn throughout the presentation that there is also a significant financial burden on the state from use of these products. We cannot do this work alone. It will take advocates from across the state and industries coming together to put pressure on our lawmakers. Our message is clear. Increasing the cost of all tobacco products is one of the most effective ways to reduce use and, in turn, to lower Iowa's cancer rates, improve the health of Iowans, reduce healthcare expenditures, fill a budget shortfall, and improve Iowa's workforce. We will have time at the end of the presentation for Q&A, but feel free to add your questions in the chat and we'll have one of our members monitor the chat and respond. I will now pass it off to Christina Hamilton from the American Lung Association to introduce our first speaker, Dr. Anthony Fisher, who will share the health impacts of using tobacco and nicotine products.
Thank you, Jackie. Good afternoon, everybody. I am Christina Hamilton. I'm the Iowa Advocacy Director for the American Lung Association. It's my pleasure to introduce Dr. Anthony Fisher, Clinical Associate Professor and Division Director of Pediatric Pulmonary Medicine at the University of Iowa. Dr. Fisher is not only a leading expert in pediatric respiratory health, but also an incredible advocate and champion for children's health, particularly in the areas of asthma care and tobacco prevention. Today, he'll share insights on the serious health harms caused by tobacco use and discuss how increasing tobacco taxes in Iowa could bring significant benefits for public health. Please join me in welcoming Dr. Fisher.
Thank you very much. Here, I'm going to load my slides here. Okay, thank you very much for the introduction and for the opportunity to speak with you all today. So today I'm going to talk about how increasing the tobacco tax and closing some loopholes in the tobacco tax can have benefits for Iowans across the age spectrum. So why Iowa needs increased tobacco taxes. As you have heard from others, Iowa has a cancer problem. And here are just 2 news clippings that I got from the Des Moines Register and from KWWL reporting on how Iowa has a high rate of new lung cancer cases, and we are the #2 state in cancer incidence, only behind Kentucky, and one of the only states with rising incidence. Now, one of the most important causes of lung cancer and cancer in general is tobacco use. tobacco use is a major risk factor, not only for cancer, but for other problems as well. And you might wonder, why is a pediatrician appearing here today? Well, all these, the use of tobacco starts in adolescence. And so really it is a pediatric disease at the very beginning. Cigarette smoking is the leading preventable cause of disease and death in the United States and in Iowa. It causes cancers around the body, but especially we emphasize lung cancer because it's one of the most common causes of cancer. And altogether, smoking causes approximately 30% of all cancer deaths each year. And cigarettes and other tobacco products are addictive because of nicotine. Nicotine is the major ingredient in tobacco products, and it's highly addictive. And when teenagers use tobacco products, they can develop a lifelong addiction from this. Addiction to these products can lead to the use of other inhaled tobacco products. So people can go from first being exposed through vaping to later trying smoking. Nicotine itself is toxic to the body. It can cause cardiovascular and respiratory problems. If a toddler gets their hands on nicotine, it can be fatal to them. Nicotine use in adolescence is a very important thing to prevent because it rewires the brain and affects learning, mood, memory, and attention. Teenagers, and I would say adolescents through college students, are very susceptible to trying tobacco products and developing a lifelong addiction. And it's really, we need to close the loopholes with this because there are a variety of new tobacco products that are available. This includes recently developed products such as e-cigarettes and nicotine pouches that are not very well regulated by our state. And we know that these products also contain harmful chemicals that will hurt the body. As many of you know, cancer is something that disproportionately affects Iowans living in rural areas. This heat map shows the 5-year incidence of cancer by county, where the purple colors indicate the highest incidence. And you'll notice that the rural areas are definitely affected. Well, these are the same areas that are disproportionately affected by smoking. We need to address the underlying causes of Iowa's cancer problem, and smoking is one of them. As a pediatric pulmonologist, I would be remiss if I didn't mention problems with asthma control. And you'll see in these maps here that Iowa is not doing very well in terms of taking care of children with asthma. We have fewer pediatricians than other states. We have higher asthma mortality. And in the long run, we have problems with higher lung cancer than neighboring states. We need to do something about this. So tobacco use increases asthma, the condition that I care for, and it increases cancer risk, something that's going to cause a lifelong problem. How can we stop it? What are some things that we can do as a state to reduce our risk? Well, I want to first emphasize that if we're going to have any impact, we need to start at the very beginning of tobacco use disorder. We have to recognize that tobacco use starts with very young people. In fact, 87% of tobacco users start by age 18. If we can keep people at these young ages from starting to use tobacco products, we will give them much better health throughout their lifetime. So preventing tobacco use by young people is an urgent public health concern. And I also want to point out that Iowa is lagging behind other states here. Iowa's smoking rates among all demographics are higher than the national average. We have a higher youth smoking rate and a higher youth vaping rate than the rest of the United States. We need to do something about it. We also see that adult smoking rates are high in Iowa throughout the age spectrum. If we can intervene and make children less likely to start, this will have an impact throughout the lives of the children as they get older, um, and will lower our adult smoking rates. This graph shows the e-cigarette use rates in Iowa. Notice that the youngest folks here, the 18 to 24-year age range, has the highest rate of vaping. And vaping currently is not very well regulated by the state of Iowa. We need to have closing of the loopholes to add taxes to dissuade young people from starting vaping. So how can we stop the flow of tobacco to youth and decrease usage rates overall? Well, my fellow panelists will be giving you more of the nuts and bolts, but I'll just say in brief, we need to increase the tobacco tax. We know that higher retail prices decrease youth purchases and prevent the transition to chronic use in adulthood. Teenagers are price sensitive. There is an elasticity of demand, and if we make it cost more, they will be less likely to buy it. And importantly, the increase in cost must be higher than the marketing gimmicks offered by tobacco manufacturers and retailers that give rebates and coupons for the use of tobacco products. We additionally need to tax all recreational nicotine forms and nicotine analogs. So this means newer products that are similar to nicotine and chemically synthesized. They may not necessarily come from a tobacco plant, and that will be important to include in the language of any successful law. Increasing the cigarette tax will overall decrease costs for Iowans. The estimated annual healthcare costs in Iowa directly related to tobacco use are 1.28 billion, and the projected long-term healthcare cost savings from adult and youth smoking declines due to raising the cigarette tax by $1.50 in a pack may be $167 million. I want to thank you for your attention, and I look forward to hearing from our other panelists.
Thanks so much, Dr. Fisher. We certainly appreciate, a lot of us are public health advocates on the call, but to have a healthcare provider take time from their day to present to a group shows the imperative nature of this issue. So thank you for taking your time and attention on this. So hi, everyone. My name is Tracy Kennedy. I am the Midwest State Strategist with Americans for Non-Smokers' Rights. ANR has been advocating for smoke-free workplace policies for nearly 50 years. But today I'm talking with you all mostly as an Iowan and as a mom. And this time of year, we're trying to figure out how to keep our kids healthy and safe, and also how to pay for everything, which is a very similar position for the state of Iowa. So this is so timely. We're really grateful that you're prioritizing this in a busy December. I'm going to echo a few of the comments Dr. Fisher made and build upon them, but I do welcome your questions in the chat. We learn from you as well. This is kind of a deep dive. Taxation is a complex issue, and we want to provide really the foundational elements to understand why this is so imperative. So you all can help become experts as well and continue this conversation. So I'll run through my slides, and then we do indeed have time for questions, but again, put those in the chat. So just a little bit about the history. So tobacco tax increase is needed now, probably a little past time if we're being honest, but the last time we had a tax increase was 2007. So we're coming up on almost 20 years since our last tax increase. And as you all know, inflation increases every year, and so the tax rate does not keep on pace with inflation. So that means while fewer packs of cigarettes have been sold and fewer people are smoking, revenue is declining quicker than that rate of inflation. And 2007, 2008 was really prime time for Iowa public health in terms of addressing tobacco prevention and control. And I see a lot of names on this screen. And my colleague Therese really led these efforts. She's going to speak after me. But what a time. We were the leaders in addressing smoke-free air, indoor air, and our tax. But time has passed, time has gone by, and in the meantime, the industry has taken up more space. The tobacco and e-cigarette industry are honestly one and the same. And these big competitors have been investing millions of dollars into our state to maintain their revenue growth. And to maintain revenue growth, they need new customers. And while we know that they are convicted racketeers and will lie in front of Congress, we know that they realize the numbers are if you can hook people when they're young, they're likely to become your long-term users and your long-term customer. And that's why we're here today. In addition, the tobacco industry market has changed, and I just kind of alluded to that. So in 2007, e-cigarettes and vapor products were really just hitting the market. So it's taken us 20 years as public health advocates, and we are still playing catch up. And what that looks like is higher rates of youth vaping than the national average and higher smoking rates than the national average. So we don't have a comprehensive strategy for addressing all products. So we did talk extensively about the cost. This is costing all Iowans in terms of direct healthcare costs, but also loss in productivity. So modernizing our structure, our tax structure, will help to address those rising cancer rates and reduce them, prevent youth addiction and initiation, and increase revenue. So really a win-win-win. When we talk about the economic burden, here's just kind of a visual. Dr. Fisher really teed this up well. So we have annual healthcare cost in the billions, over 1 billion. We have productivity loss over 3 billion, and the Medicaid cost of those healthcare costs, the direct Medicaid impact is 391 million. What does that look like? Just for a little thought experiment. So the average pack of cigarettes for the consumer in the state of Iowa, I'm assuming many of us on the call have not recently purchased a pack of cigarettes. So in case you have not, $8.78 average cost of a pack of cigarettes. $1.36 of that is the state tax. So there's also a federal excise tax and then maybe a local sales tax, but our statewide tax is $1.36. But the cost for each of those packs sold, so that's $22.99 in loss of productivity and $11.04 in healthcare costs. So just putting it in perspective, it's difficult for my brain to comprehend $1.5 billion or $391 million. But what I do understand is that for every one pack purchased, it's costing Iowans $34.03. So we are paying the price for nicotine addiction in our state. Again, little trip down memory lane. What did things look like in 2007? A group of individuals, some of them on the call today, but much like who are gathered, came together 50 plus organizations. As we know, tobacco prevention and control work is not easy. The path is not clear, and often the hurdles are higher than for other industries. That doesn't scare us away, but what that means is we really need this broad and unified base in order to have success. So to advocate for that dollar increase, it took 50 organizations plus, and the advocates within each of those organizations coming together to create a sense of urgency for their lawmakers. That the impact was very clear. That's the thing. Tobacco taxes are predictable, they're reliable, and they're understandable in how they provide an impact. So the number of packs sold went down 30.6%. Revenue went up 140%. And really, it's this historic convening of those in the business leadership and industry thinking we want a healthy workforce and we want to set up an infrastructure that supports healthy decision making. We can't handle a loss in productivity. That's money out the door. Healthcare professionals and public health organizations. So I think as many things that have changed in those 20 years, this recipe for success remains the same. So how do we measure up? How do we measure up? We know we're all concerned about our rising cancer rates. So we know where we measure up there. And Jackie really set the tone for the call and understanding that our highest rates of cancer and morbidity related to cancer can be directly connected to tobacco use, each and every one of them. So there are a lot of potential solutions to a complex problem, but this is something that we know is tested and will work. And we know that because our neighbors are outperforming us in terms of better cancer prevention and cancer rates, and their tobacco taxes are higher. Now I can say this because I'm a Missourian, but don't worry, we'll always have Missouri. They're the lowest tobacco tax in the country, but that is really by design. They have a constitutional amendment that requires a vote of the people. So it would take a ballot measure during a general election for Missourians to raise the tobacco tax. So that's number 50, the 50th state lowest tax in the country. So if you look at the lowest tax, 50, Missouri, and the highest tax, number one, we are 33rd lowest. And that is really a concern. And when we look at our neighboring states and how they measure up, I know Indiana's one state over, but they were just successful in increasing their tobacco tax by $2. Wisconsin is at 2.50, Minnesota at $3, and Nebraska is working on their increase this next session. So we really are lagging behind the trends of our neighbors. So yes, $1.36 gets us 33rd in line. And that's really when we're talking about the tax per pack of cigarettes. And we talk about tobacco taxes, I think that that's largely what comes to mind because it's simplest to understand. And I will say combusted cigarettes are still the number one seller and revenue generator for the tobacco industry. Smoking rates have gone down. The US adult smoking rate's gone down. The adult Iowa smoking rate is still higher than the national average. But really, what concerns us is that we currently have no tax on the books. That's right. No tax is charged on e-cigarettes and vapor products or nicotine pouches, which are like these Zen products. So that means all of these neighbors, we just showed the slide that had their cigarette pack tax rates, but they are also taxing vapor products and nicotine pouches. So we are calling on our state to modernize and create a comprehensive structure that taxes all products in a way that doesn't inadvertently incentivize using one product versus another, because that gives the impression that one might be safer than another because it is cheaper. So now is the right time to look at those definitions in statute and really take an approach because this broad base will help us to realize the public health benefit and the revenue benefit. So if we want to get this win-win-win part of the strategy, we have to have this comprehensive approach. We did talk about how we know cigarette taxes are a reliable source of revenue. What does this look like? So visually, this would bring in $82.9 million in new revenue. And then an associated savings, which we kind of estimate based on other states. 5-year savings to the Medicaid program, 2.8 million. And long-term healthcare savings, that number just continues to grow, about 167 million. So that's the dollars and cents cost, but we know that also means lives saved, which is on our next slide, really the home run here. Tobacco taxes work. And when I say tobacco tax, from here on out, now you know, now you all know, that means a tax on cigarettes, a tax on e-cigarettes and vapor products, on nicotine pouches, and other tobacco products like cigars. When we have a strategy that taxes these products, we know that it prevents youth addiction and smoking initiation because youth are most price sensitive. Of all of the groups that may be impacted by a tax, youth are the most price sensitive. That is likely why we see the industry come in and fight taxes so hard. In fact, if you are out talking to a lawmaker and you hear pushback on a tobacco tax, their talking points probably came directly from the industry. Because if youth can't access these products, they have no new customers. For those on the call that might provide cessation services, we so admire what you're doing. And you know more than anyone that preventing someone from ever starting nicotine addiction, nicotine is a very well designed and effective drug. It alters your brain chemistry and neural pathways that make it nearly impossible to quit. But fortunately, the tobacco tax both achieves preventing youth from starting to smoke and incentivizes quitting, which will then help improve health outcomes like reducing cancer rates. We are very concerned about rising healthcare costs in the state of Iowa and across the country. And this is one way we can address those rising healthcare costs and how to address our gaps in Medicaid spending. The cost of the Medicaid program, which is essential to our state, is going up, and we need new ways to pay for that. Also, this helps for our business leaders to create a stronger and more productive workforce. And again, generating this new, reliable source of revenue without raising general taxes. This is a use tax. And speaking of use, if you're wondering, how will this revenue be used? We are recommending, as a coalition, as the Iowa Health Initiative, a clear, responsible approach to this new revenue source. So the increase in revenue will not be earmarked differently than the current structure. So the money goes into the Healthcare Trust Fund. Nearly all tobacco tax revenue supports Medicaid costs. And with these, as I just said, with these costs rising sharply, this will help to stabilize the system and supports really fiscal responsibility for our state and improving public health outcomes. So I just provided a lot of information, some of it very technical in detail for just after lunch on a Monday. But this is just the start of the conversation, and I'm going to turn it over to my colleague Therese, who you cannot say no to. So please listen on how you can help move these efforts forward.
Thanks, Tracy. I just really want to thank everybody for joining us today. And we know that the session is quickly approaching and everybody's putting their legislative agendas together. And so we wanted to make sure that everybody was familiar with this campaign. And thanks for those of you that were with us last time and are joining us again. As Tracy reviewed, we had a similar campaign, very similar in 2007 when we had the last tobacco tax increase, and why this is so very important, not only in the work that we do to reduce the burden of tobacco and cancer on our state, because this is the only evidence-based policy that exists today for legislators to be able to actually make a difference to reduce the burden of cancer. And so as we're looking at in moving this campaign forward, we had over 50 organizations last time. We are inviting you all to help us and think about it from a perspective of what can you do to improve the health of all Iowans. And you've heard a lot of information here today from my colleagues and healthcare professionals about what this means and what it will do, and the history behind this. And so at the end of the day, the goal ultimately from the Iowa Tobacco Prevention Alliance that brought this forward is to modernize Iowa's tobacco tax system. It's severely outdated. It was created that way. Chapter 453A is a mess. And it's created a variety of loopholes. And so the goal is to modernize our system, to bring it in up to par and make sure that as new products are created, we're not leaving loopholes for them to not be appropriately and properly taxed as they take over a way for folks to engage in smoking, whether that be through vape or what have you, in order to get their nicotine. So however it's delivered, it shouldn't matter. It all needs to be treated the same. So we're asking you to join with our other healthcare partners, businesses, nonprofits, community partners statewide, whatever your entity, nonprofit, corporate, doesn't matter. Come together and join us to be part of this coalition. So what it means to join this coalition. So we're inviting you. One would be to sign up. So we're going at the in a couple more slides, we'll have a QR code that you can connect to. We'll ask for your information and just really invite you to formally become a partner in this campaign. What does that look like for you? It means putting your logo, putting your on a paper with others, putting your name on a list that says your organization fully supports this. You fully support this as a way to reduce the burden of cancer, to improve Iowa's healthcare delivery system through Medicaid, all of those sorts of things. The structure of this moving forward is we're launching the formal campaign in January, and in doing so, we would invite you to participate in monthly coalition calls. Those are listed there, and we have those, and we'll be scheduling those, or those are scheduled for those times. There would be a Zoom link for those, and we'll be sending those once you confirm your organization is a partner. You will gain access to information and advocacy materials that will support this campaign, basically everything that your organization needs. And if we don't have it already created, we will make sure that we have a great supporting team amongst the organizations that are part of the initiating group of this to put these things together to be able to support everybody's needs for questions that you have, what have you. So, and then finally, engaging your membership or your advocacy connections. So, whether it's your volunteers, making sure this gets on your legislative agenda, talking with policymakers, and participating in the coalition's activities, whether it's sharing social media posts, creating public awareness. And then we will have a website being launched here shortly with or ready when we launch the campaign officially. That will be available with all of the materials and information to be able to support you in your outreach in the campaign of this initiative. We just want you to put on your calendar. We will have an official Iowa's Health Initiative Advocacy Day or Lobby Day on April 1st. And so we would just invite you to join us that day, whether it's you or representatives from your organization, staff, volunteers, advocates, whatever it is, to come and be a unified voice as policymakers are winding down session, trying to figure out how to balance their budget, how they're going to afford increased Medicaid costs, all of those sorts of things, continuing to point to this as part of the solution, but then also recognizing the cost savings on the other side. So Tracy outlined the revenue increases that the state would bring in, but also understanding that there's a lot of savings in there as well, whether it's the number of lives or healthcare costs that are reduced because we reduce the number of rates of smoking amongst our youth and our adults. So here is the QR code that I promised. So know that what your partnership in this campaign will do. And I know a lot of you got to take it back to your boards or your supervisors, whatever your coalition or organization leadership to make this decision about this is something whether or not you'll sign on to. But we just want to make a formal ask to everybody on here today that together we can get this done. We've proven it before. As Tracy said earlier, we are far past the prime. We're nearly 20 years into our last tobacco tax that was increased. And then we are so desperate to make sure that the vapes and the nicotine pouches are also included in this because what's happened is people are using those products instead because they're more cost effective or they use them in addition to smoking in places where they otherwise couldn't get their nicotine fix. And so we just invite you to be a part of this coalition. And we just really appreciate your leadership and commitment to making Iowa healthier. I know when we passed this in 2007, and then on the heels of it, we passed the smoke-free air law. Those two items were identified as the most significant changes in healthcare policy in our state's history. This policy passing by updating our definitions and increasing the taxes would be another significant change in our healthcare policy to make sure that we aren't leaving different substances, different uses of these products behind and leaving them open for our kids to be able to access them. So I just would, I think we're at the closing point here, is share the contact information for for the coalition's leadership team. And so I think you've heard from Christina and Jackie and Tracy. Census is with the Iowa Heart Association. And then Carrie is with the Campaign for Tobacco-Free Kids. I'm here representing Clean Air for Everyone, Iowa. And we just invite everybody to again, take this information back to your organization, invite them to be a part of this history making policy change that we will be initiating as the state struggles with budget challenges, but also increase costs in Medicaid and all the things that come with that. Tracy mentioned as well that the money in the past for tobacco tax has gone to the Healthy Iowans Tobacco Trust. It doesn't mean that the legislature will put the money there or won't, but just know that that's the history of that, as well as that it helps free up other general fund money that otherwise would be going to help supplement or cover increased Medicaid costs that our state is going to be is currently facing and will continue in the foreseeable future. All right, I think we're open to opening up for some questions. So please put them in the chat, and we look forward to hearing what you all have for us. Thank you.
Okay, Teresa knows I'm not shy, so I'll just jump in. My name is Cody Smith. I'm the Director of Climate Initiatives at the Iowa Environmental Council. You may wonder why we have an interest in the tobacco tax, obviously for many of the reasons you just discussed. But one of the things that we're pursuing this year at the Capitol is radon mitigation and testing. And so I know that this may not be the first question that you wanted to answer, but at what point in this conversation, if at all, and I know Jackie, you discussed this at the Cancer Consortium the other day, do we talk about where the revenue goes? And is radon mitigation a potential option for that? I just want to know, as I'm meeting with legislators, that they're going to ask me the question, right? How do you get money for these systems, for these programs? And I don't want to be out in front of the coalition at the inappropriate time. So I just wanted to get your perspective on that and how I can be a more effective partner. Thanks for all the information today.
Hey, Cody, thank you. I think that's such a valuable question because I know it's one that many folks have. Even as we've been having this conversation with policymakers already, that it's one that I think they're thinking too, like this new revenue generated. There's a lot of need out there across the state. So I know one of the things that the legislature did in the past was they made that commitment that it was all going to be for health, right? And so that's what created in 2007 all the tobacco tax revenues to go to the Healthy Iowans Tobacco Trust. And like I said, it does free up. One of the things we encouraged before, and we're moving forward is you can continue to advocate for whatever appropriation you want on behalf of your organization. We support this tax increase, and we believe that X number of dollars should go to X, Y, or Z. And so that's what a lot of groups did last time. They were successful in securing additional resources. Can we say they directly came from the tobacco tax revenues? I don't know that we can say that because of how they directed the dollars. But like I said, it does, in retrospect, it really does free up additional dollars that others. So it is a revenue generation. Is that helpful?
It is. Thank you very much.
And we invite to that point, we invite other organizations to make that ask of policymakers as you see fit. We know we're dealing with a minimum of 83 million. Outside of that, it could be we know there's additional dollars because we can't account for the vape or the Zyn tax because we don't have the baseline data because it's currently not being taxed.